Now, I would like to ask Dr. Mahendar, you said that there are a couple of questions that I would like to ask. You said the students should have a fair idea of where they are going even before they come to the final year. Now, what would you suggest is the role of the student, the role of the parent, and the role of us teachers over here in helping the student, get some clarity regarding that?
Ma'am, the biggest difficulty is getting into post-graduation. The bottleneck is at the PG level, right? That is accepted fact, and that is not going to change in the near future. So we're talking about a decade at least. If anybody had a chance of looking at Srinath Reddy's commission report, the HLEG report, it's online. It's a Planning Commission of India whatever, org, that is there. The likelihood of seeing a one-to-one postgraduate seats is not going to be in the next couple of decades. That is clear. The government policy is now. Even if the government was to enact a policy now, it will take at least 2 decades to really fructify. So be prepared for this bottleneck, a tight bottleneck at this level. Then, if you don't do, some of the questions are coming possibly because I think you're worried that you're not going to get into PG, so you wanted to look for alternative route. Maybe that is true. But remember, the difference between an RMP and an MBBS is a 4-letter word, RMP is a 3-letter word. I mean, that is the way the training is gone. I might be really abrasive in saying that, but that is going to be a fact of life. When you go out into the real world, you have to face it. That is only the thing. And then the real life situation in the current system is students that are coming back from China are ready to work for free in these corporate hospitals. As ma'am was mentioning, 80% of your jobs and all are going to be the private sector. Coming back from the other countries because they never had a chance of putting a hand on a patient, they are ready to work for free, and that is, they are being inducted into the hospitals as duty doctors. That is happening. So they would not pay you more than a driver's salary if you want to work in a hospital. That's a fact of life. Very blunt, but that's the truth. So you really have to get into a PG qualification. National, international, doesn't matter. DNB, MD, doesn't matter, right? But it is imperative that you get into a postgraduate training. So the problem with this is the generation is about the same. You guys are as smart as what we were, and perhaps what your parimam is anybody, right? Nothing has changed. You're as dedicated as we were. But what has changed are the volumes. If the Harper's edition speaks about it, the edition of Harper was single chapter written on the molecular aspects. And if a professor asks you the full form of PCR, it means that you got a distinction. From there, the most recent All India Institute of Medical Science paper had 5 questions on molecular techniques, 5 questions. So in the volume of book 50-50, entire metabolic cycles 50. So there is so much that has come in just about a decade. How are you going to keep up with that? This is the same thing with all subjects. Now, this puts a lot of pressure, right? This is where you really have to plan things ahead of time. So interact with your faculty. That is the best and the first important step. The second thing I would say is don't believe in successful seniors. You rather learn from seniors that have failed. They give you a better advice. That is the second thing I would say. And involve your parents in this kind of decision making. That is very, very important, because we are the profession where you'll be dependent on them for about a decade after you get out of your MBBS. Sadly. It's going to be the case, right? So it is important. It's not that it's wrong, maybe right, wrong. It's all cultural thing, but I'm not pointing to that. But means you need to prepare them at least. You need to tell them, I might be needing 5 to 6 lakhs as an expense until I settle down, right? All these things are very important. And for the faculty-wise, ma'am, I would say, awareness programs and encouraging them to remodulate towards competitive exams when they are itself. That is a very, very important way. It is only reinforcing. Apparently, we had this discussion earlier with some other faculty. They were saying you're stopping people from getting into the proper training. No. Getting ready for a competitive exam is not stopping you from learning. See, first year when you're in anatomy, you finish your anatomy. Second year when you read anatomy, read the MCQ books. You're revising your anatomy, you're doing your MCQs, you're getting ready for the competitive exams, and you're making your ability to understand the other clinical subjects better. Neurosurgery posting, you understand your neuroanatomy. Then neurology, you understand your neuroanatomy, like that. So that has to be there. From the parents' perspective, I mean, they have to understand that the children are anyway immature. When they get distracted by various things. And what is completely lacking is a parent coming and talking to faculty. I've not seen one faculty, because I continuously interact with them, not one faculty has told me in 3 years of me coming back to India that I talked to a parent. It was not the case. My dad came and talked to my Professor Ashwini Kumar. I mean, that relation is completely gone. And I think the problem is more with the parents than the faculty. Faculty, even today, would want to give an appointment for 10 minutes if a parent is going to come and talk. So that, I think, I would put the blame squarely on the parents. They're assuming that this is all done. See, that is not the case. It would be better if that kind of a system gets inculcated, starts somewhere and then continues. I think would be the best way to look forward, ma'am.